Hey Mama Good Juice, what's up y'all? Welcome back to my channel. I'm 40 is the new 20 if you're new to my channel. Here lately I've been talking about how to become a pharmacy technician and what it's like to be a pharmacy technician. You are going to hear a lot of birds because it is like 7:30 and I guess this is their time to sing. Okay, so I'm just going to answer a lot of questions that you guys have been asking. And I'm going to talk to you about another topic, what's down in the description about making mistakes in the pharmacy. So let me talk about the questions that you've been asking. But first, Miss K. Gray, I would like to congratulate you on passing your PTCB exam. I see that you have your license, so congratulations. I just wanted to applaud you on that. I have another question from someone named Meow Thin, and oh, this is pretty long. Okay, so let me see. You spoke the words I need to hear. Seriously, I almost cried. Okay, so hold on. Let me read this real quick, and I'll come back to you.
5 minutes later.
I'm back, y'all. Okay, Miss. I don't know if this is. Well, it sounds to me like it's a woman. So I'm just gonna say Miss Meow Thin. She's doing some at-home studying, which is great. And that will work up until 2020, so that's great. And I see that you live in Arizona. So let me first of all tell you guys the places, the states that you have to live in order to become certified. If I don't list this state, then you do not have to be certified. I did this research for you guys, okay? So licensing normally requires passing a test in specific states. Okay, so I'm going to list these states for you guys. Let my neighbor do his thing. I'm sure you guys can hear that, so let me let them drive off. Okay, because I want you guys to listen carefully to what I'm saying. The states requiring certification for pharmacy technicians are, and yes, Meow Finn, Arizona is actually the first one. So yes, you do have to be certified in order to be a pharmacy technician in that state. Okay, so the first one is Arizona. There's 16, okay? So there's 34 states that you don't have to be certified in, but there's 16 that you do have to be certified in, okay? So the first one is Arizona, Idaho, Illinois, Iowa, Louisiana, Maryland, Massachusetts, Montana, New Mexico, Oregon, South Carolina, Texas, shout out to Texas, Utah, Virginia, Washington, and Wyoming. If you live in these states, you do have to take the PTCB exam and you do have to become certified. So congratulations to you, Meow Finn, for taking the time to actually go out and buy these books and start studying. Like I told you guys, this is the last year. Well, actually, this is the last year that you can take it without having to take the PTCB exam or work in a pharmacy, gaining those 500 hours, okay, of time that you need in order to spend in the pharmacy to be accepted to take your PTCB exam, okay? So if you've been watching my videos, then you already know that, okay? Okay. All right, let's continue on with the next one. I may be saying this wrong. Leisha Willis. She just stopped in. Oh, no. That was another video. Moving on. Let me see. Okay, this is Brooke Oliver. She said, I have a question. Do you think it will be worth it for me to take an online program through Daymore College for pharmacy tech? Yes, ma'am, I do. Okay. The reason why I think that, for me, I feel that anyone that's wanting to be a pharmacy technician should go to school for it. Not unless you're a person that can read a book and comprehend and soak up everything, and that's going to research every single thing that's in that book that you do not understand. If you're that type of person, then I will say don't focus on going to school. But if you're the type of person that needs visual and needs to know what BID stands for, PRN stands for, and you really don't feel like researching it, you need to go to school. But if you're a researcher, because like me, I like to research things just like I research the states. If you are a researcher, then you can pass this test on your own. But if not, it's okay for you to go to school. It's all right. So to answer that question, yes, I do think that you should go to school, Brooke. So, and I see here that you said that there are only 2 major tests that you need to pass. No, there's only one test that you need to pass. Maybe you're thinking about the state that you're in, but you do not have to pass a state test. All you have to do is pay your money in order to work in that state. But you also have to pass one test, which is your PTCB exam, okay? And if you still have questions, Brooke, please just put in the comments, okay? Put in the comments. Then you had another question. I'm just not sure if going to college for pharmacy tech is a good idea. Like I said, I think it's a wonderful idea. Maybe you can take a course at night. They're shorter. During the day, they're a lot more lengthier. And now they're actually coming out with an associate's degree in pharmacy tech, which, you know, that's 2 years, of course. But maybe you want to take a night class. But like I said, you know, with the night classes, everything is kind of compressed into a shorter length of time. So if you can learn well and learn quick, then take you a night class, okay? I hope that answers that question for you, okay? Let's see. I have one from Shane_C. He says, how long should you work as a retail pharmacy technician before working in the hospital? That is entirely up to you, Shane_C. Okay. It just depends on your preference. You don't have to work in retail first. You can go straight into the hospital, and then you may decide, hey, I want to go into retail. So it's entirely up to you. If you're in retail right now and you just want to try the hospital, start putting you in some resumes to work in the hospital setting. And it really doesn't have to be in a hospital setting. It can be in an institutional setting, like maybe at a prison that has a pharmacy inside of it. It could be at a nursing home that maybe has a pharmacy inside of it. It could be in a clinic that maybe has a pharmacy inside of it that only takes care of those patients that are inside of that facility, and not patients that are walk-in patients, meaning outpatient, like an outpatient pharmacy. But that's the things that I just listed are more of an inpatient pharmacy. So really, Shane, it's entirely up to you. Whenever you're ready to make that transition, you do that for yourself, okay? So you make that decision, okay? So it's just whenever you're ready. Okay, let me see what else. Miss Cece, all caps, Miss Cece, she asks, will you ever try to be a pharmacist? I don't know. My daughter is graduating next year in 2020. So I'm actually going to have her take my class. And I hope her and her friend decides to take my class so I can get them certified and have them move off and do whatever it is they're going to do with their life. And then I may think about it. It's just so expensive. Me and a pharmacist, we were talking about that, and I was explaining to him how expensive it was, and he was telling me how less expensive it was when he took his test. So I don't know if I'm prepared to pay back student loans. I just don't know if I'm prepared for that. So I don't know. I'm not for sure on that. Okay, let me see if there's any other questions. Okay, there's King_Vary that asks, can someone explain to me what are the benefits of becoming PTCB certified? In my state, I had my state license before I took the PTCE and had already worked for 2 years at CVS. I'm going to read that one more time because I know that sounds real choppy. Okay, it says, can someone explain to me what are the benefits of becoming PTCB certified? I had my state license before I took the PTCE and had already worked for 2 years at CVS. Okay, that is a wonderful question, King Vari. First of all, it depends on, like I said, it depends on what state you live in. And I actually listed those states earlier in the video, okay? So let's just say you live in a state where you have to be PTCB certified, or you have to be a certified pharmacy technician. Let's say that, okay? what you have to do, whatever state that you live in, they will give you, listen to me carefully, okay? Whatever state you live in, you can apply for that state license, okay? And that lasts for 2 years. That is considered a trainee license, okay? And that trainee license lasts for 2 years, okay? That allows you to work in the pharmacy, to train, do everything that a pharmacy technician can do. And during that 2 years, either you're going to school, either you're studying at home, either you're gaining your 500 hours, okay? But after those 2 years is up on that trainee license expires, okay? Now we're still talking about if you're living in a state where you have to be PTCB certified, okay? Now, after that 2 years is up and you have expired your trainee license, unfortunately, you will have to leave the pharmacy, or either you can just be a cashier in the pharmacy, but you will not be able to count pills. You will not be able to type in prescriptions. The only thing that you will be able to do, you will not be, you won't be able to do anything that a pharmacy technician does, but you will be able to cashier. So yes, you can have your trainee license for 2 years, but that's it. Okay. Alrighty. I hope I explained that well. And if I didn't, ask questions. Okay. Let's see. Okay, this is Sonia Martinez. She says, I'm planning to take an online course for pharmacy technician at Penn Foster. How can I check that they are an accredited college? And Sonia Martinez, I actually already answered your question in the comments, and I did check on that for you, and they are an accredited school. That's as far as I went to find out, because I didn't find out the length of their course or anything like that. But yes, Penn Foster is an accredited school. Okay, so actually I think that's all the questions that I have. I think that's it. Okay, let's talk about making errors in the pharmacy. Okay, and if you have questions after this video about making mistakes in the pharmacy, you are more than welcome to drop a comment, and definitely subscribe to my channel. I love you guys for subscribing to my channel. I love you. Like, this is like the most people I've had subscribe to my channel, so thank you. Okay, first of all, you will make mistakes in the pharmacy. You, my friend, are not perfect, okay? Neither am I. I make mistakes in the pharmacy. Everyone that I know, and I know a lot of technicians. You would not believe how many technicians I know. And they all make mistakes, and everyone calls me, and everyone inboxes me, and everyone talks to me, and they call me about their issues in the pharmacy. And I just try to give them the best advice that I can possibly give to them. Is what I try to do. So I'm gonna try to give you guys the best advice that I can give to you as well. But you're not perfect. First of all, you will never be perfect. Now, you were made in God's image, in His image, not him. So, or her, or whoever. Okay, your God is, not putting one specific God in a category, because I don't like to do that. So you are not perfect. Okay, you are going to make mistakes. Hopefully it will not be a deadly mistake, because then you may go to jail. Okay, so yes, you will make mistakes. Everyone is going to make mistakes. I've seen pharmacists, I've seen technicians. Everyone is going to make mistakes. Okay, so what I used to do is, and sometimes I still do it, which I'm trying to get better at it. I've been watching another YouTuber named Daniel Alley, A-L-L-Y, Daniel Alley, and he is a great motivational speaker. Like, he is changing who I am as a person. Okay. Anyway, I'm gonna try to put him down in the description if I can, because like he is changing some things within me, and I would like for him to change them within you. Okay, so like I said, you are not perfect. You are going to make mistakes. As I was saying, sometimes you're going to take those mistakes home with you, and unfortunately, You're going to go home and you're going to talk about it with your spouse. You're going to talk about it with your children. You're going to talk about it with your best friends. And that's just what it's going to be. But the best thing to do whenever you make a mistake is just to try to learn from it. Seriously, you have to learn from it and not try to make the same mistake over. If you see yourself making the same mistake over, then it's time to change something, okay? Like for instance, you're constantly sending the wrong drug out to the wrong patient. Now what you need to do is start checking 3 points. You need to check the patient's name, you need to check the patient's drug, the drug, and then you need to possibly check, maybe I'm trying to think of something else that you could check. I'm just trying to think of a label. The patient's name, the drug, and maybe you can still check the route of administration, but there's a third one that I normally look at. There's another one that I normally look at. But just start double checking your work, okay? That's one thing that I can honestly say that you should start doing. Especially on your math. What I like to do whenever I work in a particular area of the pharmacy, in the IV room, the intravenous room, is I like to do my math on a separate sheet of paper and show the pharmacist exactly the math that I've done, okay? That's because if not, then you're gonna have to explain to him I did this, or her, what I did this, and this. When you can just write it out, in which I will try to teach you guys the math, which you can just write it out and show them the math that you've done and continue to work, and they'll check your math and check the medications that you're sending out. But like I said, try to double check your work before you give it to the pharmacist. You're going to make mistakes, okay? That's why you're the assistant, you're the pharmacy technician, and the pharmacist, that person is responsible for checking the final product that leaves out of your pharmacy, okay? So make sure that you double check yourself, make sure the pharmacist check your work, and then we send it out. Never send a medication out without the pharmacist verifying it, okay? The pharmacist has the last and final say on that prescription. Do you hear me? Let me say it one more time. The pharmacist has the last and final say on that prescription. Do not send any prescriptions out of your pharmacy without your pharmacist taking a look at it first and signing off on it, okay? I'm trying to think of another way that you can not make any errors. Practice at home. Write little things down that can help you. You'll know what type of setting you're in. Write certain things down that will help you, and remember to make a little check mark of the things that you need to check off. You can write on that label, just make a little check mark and say, okay, I got this. The drug is correct. The route of administration is correct. And you will also be typing in prescriptions as well, so you can check that off. Because there's a lot of things that I want to teach you guys if you want to become pharmacy technicians. I feel like this video is going on and on. But let me know if there's anything that you want to know about becoming a pharmacy technician. Like I said, it's been a great career for me. It has paid my bills. I hate talking professional all the time, because I feel like when I do that, it's not relatable. You know what I'm saying? I don't like watching videos that's super professional, because people just click off of those videos because they want someone that's relatable. And that's what I want to be to you, because when you get in the pharmacy, man, listen, let me tell you, when you get in the pharmacy, you're going to have people to cuss you out. You're going to have people to talk to you bad. You're going to have people that's going to walk up to the counter and just cough in your face, and you're like, okay, not today. Okay, you're going to have all of that. So I'm going to try to explain all of that to you. I'm just going to give you everything that I've experienced in the past 11 years if you'll just roll with me. So I'll talk to you later. That's pretty much all I have to say. I hope I've answered everyone's questions. And yeah, subscribe. I went shopping today. I did my press on nails. So, all right, talk to you later. Bye.